There are more than 1.2 million people living with Parkinson's disease in Europe today, and this figure is set to double by 2030. Parkinson's is a progressive chronic neurodegenerative disease that has no known cure. By 2040, these kinds of disorders will surpass cancer as the most common group of medical conditions. The economic impact of Parkinson's in Europe is enormous, with an estimated annual cost of 13.9 billion euros. The EPDA was set up in 1992 to improve the quality of life for people with Parkinson's and their families. We do this by raising awareness of the disease's devastating impact and urging governments to provide early, effective treatment. We are the only European Parkinson's organisation, representing more than 40 member countries and providing a unified voice for Parkinson's across Europe.
It was really important to form a European organisation. It was like making a choir. So you've got one nation, one voice, but if you start to bring them together, you've got, as long as they're singing from the same hymn sheet, you begin to get a louder voice, a clearer message going into the policymakers in Europe. And I think that was really important. And the other good thing about forming a European organisation is that you begin to share practice. Because, you know, not one country knows all the answers.
We knew how awful and difficult it is to live with something like Parkinson's disease. So we just didn't have information, didn't know how to go about, no resources. We were in a way lost, but full of enthusiasm and goodwill. So the EPDA was some sort of inspiration for us.
Of course, for me, it's a window open on the world. It gives me the sense that they are not alone, but there is a wider community.
In 1992, we established ourselves with the immediate support of 9 member nations. This grew steadily to 14 by 1997. Over the next 6 years, the EPDA expanded rapidly, growing to 35 members by 2003. And embarked on a series of groundbreaking initiatives, including the EPDA Charter for People with Parkinson's, the Global Parkinson's Disease Survey, and the Global Declaration on Parkinson's Disease. Together, these initiatives showed the level of change required to improve patient care and family support. They powerfully illustrated the EPDA's ability to stimulate global debate on the treatment of Parkinson's disease.
Because in those days, I'm going back 20 years, Parkinson's disease was regarded as just a movement disorder. But by listening to the patients, we began to realise it was far more challenging than that.
And the EPDA is really to be credited as being one of the first organisations that I'm aware of that realised the importance of multidisciplinary care for Parkinson's disease. Parkinson's really is a disorder that is too complex to be managed by neurologists alone, but of course we needed the evidence, and the EPDA has been a supporter right from the start to make sure that A, we got the evidence, that we got the guidelines, and importantly that patients were going to receive that multidisciplinary care. And EPDA, in our efforts to deliver multidisciplinary care, has been a crucial partner in that process.
Since 2003, the EPDA, in partnership with the World Health Organization, has worked tirelessly to secure the support of national governments for its Global Declaration on Parkinson's disease. We have also launched a series of high-profile campaigns that have been translated into dozens of languages and nominated for numerous European healthcare awards. These include the Move for Change campaign and the European Parkinson's Disease Standards of Care Consensus Statement.
I think the consensus statement is a very important document because it really outlines in a very concise way what should be on our agenda for the next few years. Everybody now realizes what is needed. It is there in a few lines, and this will help both clinicians, politicians and also researchers to create a better world. And I think it is the menu that we should all follow. It is compulsory reading for doctors, patients and policymakers. Whenever we think about how to change the world for Parkinson's disease, it's in that consensus document.
We hope that it will influence decision makers to put Parkinson's disease on the top of the agenda, to make it a hot topic together with other neurodegenerative diseases. And creating awareness is a key, actually, for making people live a better life.
Today, with a new president at the helm, the EPDA is delivering greater support to its member organisations throughout Europe, as well as ongoing leadership and resources for the wider Parkinson's community. At the same time, we are lobbying the European Parliament to build a meaningful dialogue between policymakers and national Parkinson's organisations. We are also taking bold measures to ensure progress is made in achieving effective early intervention for people with Parkinson's across Europe. More than 20 years after beginning our journey, we are stronger than ever.
I think without organisations like the EPDA, politicians wouldn't hear about Parkinson's disease. We come in this, it's a big building, we're busy all day, we're doing laws about different things, and we wouldn't hear the patient's voice. We'd hear the European Commission doing what it does, we wouldn't hear what's happening to people on the ground. Sometimes we might get told that, oh yeah, everything's fine, that's been sorted out. And then we find it hasn't been sorted out. We find that we've approved medicines, but they're actually not accessible to people across the European Union for financial reasons, because their doctors don't know about them. And so, yes, EPDA is essential in getting that kind of best practice and knowledge spread across Europe.
I think working with the EPDA, what Abbott really learns from the association is the real perspective of people living with Parkinson's. There's that. There's also information about the societal benefit, and really what is the impact to society, because it's not only the patients who have Parkinson's, but it's their caregivers who also live with them, aren't able to go to work, really sometimes become isolated. And a lot of times working with the association, we learn more about what the patients' actual lives are like, and it helps us be a better company.
My message to policymakers in Europe would be to give the right treatment, right medication for the right person at the right time, because this will reduce the economical impact on society, and it will create a better quality of life for people with Parkinson and their families.
We always have in mind that bettering the life, the quality of life for people with Parkinson and their families is the overall goal. And if we can achieve that, EPDA has fulfilled its mission.
As the leading voice for Parkinson's in Europe, the EPDA will continue working with its partners, including EU policymakers, the treatment industry and the media, to establish autonomous, well-funded Parkinson's disease organisations, and ultimately, to improve the quality of life for people with Parkinson's and their families everywhere. Together, we can make this happen.